A more accurate description of periodontal plastic surgery terms and procedures. The first term that we'll deal with is the term free gingival graft, or FGG. The proposed term, or a better term in my opinion, is the epithelialized palatal graft, the EPG. And here's my rationale. The word free is redundant because a graft by nature is free or detached. Additionally, the term free is not a scientific term. Term number 2. The current term is connective tissue graft, CTG. Actually, the preferred term in my opinion is a subepithelial connective tissue graft, SCTG. Here's my rationale. This is a non-epithelialized graft, which distinguishes it from the epithelialized palatal graft that we just discussed. Now in the palate, there are two types of tissue below the epithelium, connective tissue and submucosa. The object is to harvest the connective tissue and not the submucosa. Term number 3. The current term used, see it all the time in the literature, is a coronally advanced flap. A better term, or proposed term in my opinion, is a coronally position flap. Here is my rationale. To advance means to move forward. In this procedure, which I think is the simplest root coverage procedure, the flap is not advanced forward, but is positioned coronally. And here we see what we're talking about and how the flap is coronally positioned. Term number 4. Current term is a lateral sliding flap, or a pedicle graft, or a pedicle flap. I think we should use the term laterally positioned flap, just as we did the coronally positioned flap. The rationale is this procedure was originally presented as a lateral sliding flap. The term sliding is not an appropriate scientific term. Pedicle means little foot, and in this procedure the flap is moved laterally or positioned laterally. Here we see on this cuspid we are doing a laterally positioned flap. Term number 5. Proposed term is a new term, the obliquely positioned flap. And here's my rationale. This is a new term which describes a coronally positioned flap on a maxillary central incisor. The flap is coronally positioned obliquely so as not to coronally position the frenum. And here we see outlined how the flap incisions are made in an oblique direction, and you can see the frenum is avoided and is not coronally positioned. Term number 6. Apically repositioned flap. The proposed term, and many people are doing this correctly now, this is an apically positioned flap. The rationale, repositioned, means to replace or put back. This procedure apically positions the keratinized tissue. This is used in pocket elimination surgery and in actuality is not a periodontal plastic surgery technique. And here we see where pocket eliminating surgery has been done. We've saved the keratinized tissue, we've created health, but what we've created here is a class 4 recession, because if you did want to do root coverage on this, this would be an impossibility. The next term is term 7. We often talk about the term gummy smile, but the preferred term that I propose is excessive gingival display. Let me give you my rationale. Although gummy smile is understood by the patient, it's not a professional term. Therefore, excessive gingival display is certainly more appropriate. Term number 8. The current term used is crown lengthening surgery. I propose the term crown exposure surgery, and here's my rationale. The cemento-enamel junction defines the crown of the tooth. The crown is not lengthened. In this procedure, we expose the anatomical crown. There are two types of crown exposure surgery. One for aesthetics in the maxillary anterior, and one for function. The former is used in treating an excessive gingival display. The latter is performed to expose adequate tooth structure to be restored. And here we see an example of the excessive gingival display, which is treated by crown exposure surgery. Term number 9. Current term, frenectomy. Proposed term, frenal surgery. What is the rationale on that? When treating an aberrant frenum in the mandibular arch with significant recession, the frenum is not necessarily removed. Often by grafting, attached gingiva is gained coronal to the frenum without doing a frenectomy. In the maxillary arch, frenal surgery generally involves much more than a simple frenectomy to maximize the aesthetics and to prevent the dreaded black triangle. And here we see the situation with the aberrant frenum with a significant recession, and a pouch has been created. We can see the connective tissue placed in the pouch, and here we see about a 25-year post-op on this case, showing that we do have root coverage, we do have attached gingiva, but the frenum was not removed. For more in-depth information and details on surgery, please use the on-screen annotation or the link to the video description to view the video lecture number 18. That is titled Surgical Management of the Mandibular Frenum. Here we see a fleshy, unaesthetic maxillary frenum. And by doing a laterally positioned flap and simply plastying the interdental papilla, we can achieve a very aesthetic result. But please note that this involves much more than a simple frenectomy and includes the use of a laterally positioned flap. For more in-depth information and details on this particular surgery, please use the on-screen annotation or the links in the video description to view this video, which is lecture number 17, which is titled Surgical Management of the Maxillary Frenum. Term number 10. Current term is biologic width. Proposed term is biologic length. My rationale is violation of this dimension in restorative dentistry creates a periodontal problem. This is a vertical component and not a width component. I debated whether to use the term biologic height or biologic length, but do we talk about the height of a tooth or do we talk about the length of the tooth? And typically we talk about the length of the tooth. That's why I selected the term length rather than height. Here we see creation of the biologic length. The biologic length is typically about 3 millimeters, and we want to match up the soft tissue margin, gingival margin, with the adjacent tooth. So therefore, I think biologic length is a better term than biologic width. Term number 11. A misused term is mucogingival surgery or soft tissue surgery. The proposed term is used by many people already as periodontal plastic surgery. The rationale. The term mucogingival surgery has been antiquated for over 30 years. Mucogingival surgery is designed to gain a functional result, and periodontal plastic surgery gives not only a functional but an aesthetic result. The term soft tissue surgery, in my opinion, has no meaning, so please do not use that term. Many of these dated terms are so ingrained it will take a long time to clear them out and use these new terms. The place that we want to start is in our residency programs using the better described terms that I have outlined for you here. And certainly as the young periodontist uses these terms for 3 years in residency, hopefully it'll carry over and we will begin the transition to these more accurate descriptive terms.